Yeah. Ooh, yeah. Yeah, yeah. Oh, yeah, yeah. Oh, I saw her and she hit me like that. Saw that thing so beautiful. She just hit my heart. Oh, full force and she got me like I be like.
Welcome, everyone. Thank you so much for joining us today. We are excited for our September Collaboratory. I'm focused on centering authentic dialogue around COVID-19, birth outcomes, and vaccinations. My name is Brianne Taylor, Bree like the cheese, and I'm the program manager for Discovery and Precision Health with the California Preterm Birth Initiative. I will be co-facilitating this collaboratory. We are very excited to have you with us. If this is your first event with the California Preterm Birth Initiative, we welcome you to join us every month at our collaboratory series to think through and generate new ideas, collaborations, and innovative approaches to, innovative approaches to preventing preterm delivery and improving outcomes for babies born too soon. Today, we are honored to host COVID-19 Birth Outcomes and Vaccinations, a public dialogue led by Community Voice. This month, our organizational highlight is Shades of Blue Project. Shades of Blue is dedicated to helping women before, during, and after childbirth with community resources, mental health advocacy, treatment, and support. Their vision is to change the way women are currently being diagnosed and treated after giving birth and experiencing any adverse maternal mental health outcome. If you want to learn more or contribute to their mission, you can do so at their website, which is on the slide and will be posted in the chat as well. We also hope you will join us next month for our October collaboratory entitled Centering Black, Queer, and Trans Birth, where we will be featuring trans advocate and educator, Kaden Coleman, as a keynote speaker. You can RSVP at the link in the bio, in the chat, which is also posted in the chat.
Hi, everyone. I'm Dr. Dalif Pulowski. I direct Discovery and Precision Health with the Preterm Birth Initiative, and I'm just thrilled to be co-facilitating this collaboratory with Bree Taylor. It is a little of a different format. What we really wanted to do was be led by community voices in terms of questioning comments around what's happening with COVID-19 right now, and especially, of course, with pregnant people and with important questions around the vaccines. We're going to really start the collaboratory with a grounding in what's going on right now in terms of COVID-19 and pregnancy. We'll also be talking about how, when we have these discussions, it's super important to be thinking about them in the context of historical injustices in Black and Brown communities. So we'll be doing some grounding in that space as well. Then I'll have a short back and forth with Dr. Deb Karasak, who led the recent paper looking at preterm birth and COVID-19. And then we'll be moving into these panel discussions where we're really dividing the panel discussions into first, listening to videos from individuals in the community, and then asking our panel to respond to the different issues that have come up. Then we'll have some audience Q&A, and we'll engage in an accountability activity and do some closing. I do want to highlight down at the bottom there that together with Dr. Deb Karasak, the two of us will be giving a presentation next Wednesday at the Bloomberg School of Public Health, where we'll spend an hour really talking about COVID-19 and pregnancy in terms of what's happening now, what we know in the research, and getting more into what's happening in California. So Selena's putting the link to that in the box in case you want to sign up. They are asking that people RSVP. So please join us if you want to engage in sort of a longer and deeper kind of conversation and learn more. So with that, I also want to really call out special thanks to Brandy Gates and Pastor Ben, who helped organize our listening session. Bree is going to talk about what happened there and why we did it, and it was amazing. Brandy is a PTBI Community Advisory board member. She's an expert in lactation, and Pastor Ben is the lead pastor at Congregation Rehoboth in Alameda. So thanks, and again, welcome everyone.
Yes, thank you so much. Okay, now we move on to introductions. So I want to thank each and every one of our listening session participants. Please know that given the sensitivity of the subject and that several of the participants have reported being bullied around vaccination issues, we're using first names only and invited women to use a different first name if they preferred. As I'm sure we all understand, given the sensitive nature of this discussion, not all listening session members have chosen to sit on the panel today, but a few are here. So I want to thank Vanessa and Brandy for being here. The listening session participants were Avina, Bobby, Vanessa, Kiki, and Vanessa. Our panelists today are amazing. We have asked them to share some of their experiences during the pandemic, respond to the different issues raised by community voices, and answer audience questions towards the end of the session. We have with us the wonderful Dr. Karen Scott. She is the co-founder and co-owner of the Anarcha Institute. We have Dr. Deb Karasak. She is an assistant professor at the OB department in UCSF School of Medicine. We have Martha Tesfulo, who is an assistant professor in the MFM program. We have Elizabeth Rogers, who is a professor of pediatrics and a director in the intensive care nursery. We have Yvette Robles, who's the program manager of community engagement and partnership with UCSF Preterm Birth Initiative. And we have Dr. Malcolm John, who is a professor of medicine and the director of the UCSF HIV/AIDS program.
Excuse me, Bree, I just want to correct, I'm a former director of the HIV/AIDS program. I'm the current co-chair of the Health Equity Council. I wanted to acknowledge the current director.
Okay. And you have an incoming role. Do you want to say what your incoming role is?
I will be the inaugural medical director of health equity for UCSF Health. So start that tomorrow.
Awesome. Congratulations.
Thank you.
Thank you so much for joining us today. And I want to say thank you to all of our panelists and participants. Without you, we would not be able to do this. So thank you so much.
You can tell we're waiting for slides to open, so I apologize for the little. I will. Great, thank you, Selena. Selena is our director, so really so grateful for you, Selena. Really, really, director, producer, extraordinaire. So I just wanted to provide a little bit of grounding. I know that there, especially from being lucky enough to sit with community members, there are different levels of understanding of what's happening with COVID-19. There are a lot more questions that came up in that listening session than we'll get to today, but we will be posting additional videos and Q&A online after this. By about mid-October, we'll try and get all questions answered. But just for a little grounding, and I think most folks have heard this, in the left panel there, in case you're having a hard time seeing it, you can see that after really enjoying quite a decrease in COVID-19, we saw really this resurgence happened in the spring and going into the summer around the country. And while with the rates, we're starting to see some of that decline again, you can see we're still much further up than we were at our lowest times. So the vaccines got us so far, and then really the Delta variant sort of joined the stew and is now almost 100% of the variants of COVID-19. And we certainly know that Delta is more contagious, associated with more severe illness, and we have seen some breakthrough infections. And then on the right side, reflecting what I just said, we can see that with Delta, not only increased rates, but we've seen these increasing risk of death with the Delta variant. So we remain, of course, quite concerned about what's happening right now, especially as we move into the colder months around the country. Next slide. Thank you. And you can see at the same time that we're seeing sort of the resurgence in infections, we are seeing, of course, some increased, of course, massive at the beginning, and some continued increase in vaccinations, but they've really sort of evened off. We're not getting as many new vaccinations as we would like, and we're really sort of hovering at this rate of vaccinations that's less than we would like to see at a population level, especially when we're combating something like the Delta variant. So with this, back one, please, Selena. So the CDC is now including a panel on what's happening with vaccinations in pregnant women. And now you can go to the next one. And in fact, yesterday, the CDC launched an effort to really try and increase the number of vaccines in pregnant women. It's still hovering below 40%. And this is particularly concerning because we know that COVID-19 is especially dangerous for pregnant women, individuals that are pregnant, women and pregnant people are more likely to get severe infection. And we know that there's this relationship with an increased risk for adverse outcomes. But one of the things that's happening, and really one of the reasons, the guiding reasons why we're having this discussion today, is that for those of us who've done interviews about sort of the patterns that we're seeing on COVID-19 and adverse outcomes, we always talk about a need to meet women where they are and understand that people have questions and that not everybody wants to get vaccinated right now, and that people are in different timelines, people have different needs, and that it's really important to be meeting people where they are, have that discussion, and also broaden that discussion to think about things like health and other issues while we're at the same time advocating for a vaccine. So that's really the framing of this collaboratory, which is, and I've written time for a reboot, time for a reframing. The reframing isn't the need to be vaccinated, and it isn't advocating for vaccinations. It's a reframing of how we talk to people and treating everyone with grace and a history and a focus on their health. And so with that, I want to move us into the next phase, welcome everybody, but encourage all of us to think about doing things different in terms of meeting women where they are. Thank you.
Thank you, Laura. Next, we move into a bit of healthcare mistreatment and violence. And we decided to go with this framing, one, because it's very important for our discussion today, and also because it was brought up during our listening session. So next, I will pass it to our listening session participant, Vanessa, to describe what the clip is and why she felt the need to have it there.
Hello, my name is Vanessa. I was part of this panel whenever we were asked about our hesitations with the COVID-19 vaccine. And some of us were new mothers, some of us were pregnant. And I just discussed some hesitations that I've seen in my family and just women in my community. I come from the border and I'm also a resident here in Oakland. So it's just something, these are some topics that I don't think are commonly discussed like in the media and with doctors. So it was just something that I thought was important to consider. Like one thing that hasn't really been focused on is like the history of, you know, the oppression that has been done on darker melanated people, specifically Black women. And, you know, a lot of Latino women on the border, a lot of times they would be like, you need to do this. And I know times have changed.
Sterilizations and all kinds of
forced abortions. Like, I think that's why not everybody should, you know, be told to do this, because there's a lot of trauma in our communities. I mean, more so Black women. So like my heart is with you, and like that just hurts my soul. Like, why would you force something when there's all this unresolved trauma around medical and women that are pregnant?
I live in that.
So thank you, Vanessa, for providing that framing for us.
Okay.
All right, so now we will begin with Miss Yvette Robles, starting us off with some ancestry and historical injustice.
Greetings. Thank you, Bree. And thank you, Vanessa. So I'd like to begin by acknowledging our ancestors and what they lived through, the knowledge they have produced, and the legacy they have passed on. Yeah. So I feel that it's really important for all of us to consider this in our conversation today, as it's foundational in accepting different ways of experiencing and expressing different ways of being in the world. And so starting with ancestors also creates a pathway to clarifying that social history matters, be that on the tangible individual level or the abstract societal level. Social history can be thought of as the substrate that informs how we interface with our external environment. Our social histories tell us what worked and what didn't. It functions as a mechanism of survivance and adaptation. I like to think about how nobody is ever separated from their social history. This is a primary reason why we must all do our work in addressing anti-Black and Indigenous systems of oppression, terror, and violence. None of us is separated from that history. However, all of us do have our own unique relationship to social history and the manner in which our present time orientation is informed by it. In essence, to fail in acknowledging the role of social history and its impact on our lives is to fail at doing no harm, equity, compassion, and love. The pandemic is no exception. Countless people, specifically Black people and brown people, are intentionally and violently being left behind because of choosing to not get vaccinated, which is informed by social histories. Current conversations around the COVID-19 vaccination fail to consider that we do not all share the same experiences and ways of being in the world. And this leaving people behind is unethical and immoral, and it is grounded in racism. I believe my ancestors. I believe their experiences. I believe my family. I believe my community. And I believe the collective memory that is constantly being reclaimed and remade in the image of love. We can choose to take a non-dualistic approach to care that respects and honors all people. We can cooperate and imagine other ways of being and building together. And I am constantly being reminded that moralistic judgments are violent. And when we lose our ability to govern our bodies and choose what happens to our bodies, we enter into the all too familiar realm of subjugation. Thank you.
So much of that. I'm not sure. Thanks so much of it. Like many of us in the Preterm Birth Initiative are so blessed to work every day with Yvette now that she has joined us as a program manager of community engagement, although she has really helped us for years in this space. And so just really grateful for that grounding around, how do we do this work with really peace and love. So I want to pivot now to talking with Dr. Kara.
Before we pivot, can I say one thing?
Oh, please. Yes, go, please.
I had a piece that came to me as well. We introduced healthcare violence and neglect as this directly impacts our discussion today. Black and brown people have been subjugated into conforming to Western ways of being as it relates to health and healing since the beginning of colonialism. Our ancestral and indigenous ways of healing are criticized and vilified. We include eugenics as it seeks to improve the human population and its gene pool through encouraging fit individuals to procreate and discouraging or preventing the reproduction of the unfit. The current medical system was never designed to cure us or to heal us. Medical harm continues to this day, ranging from experimentation to genocide through sterilization and medical error. We end with systemic racism as the culprit for all of the issues, not the victims of systemic racism. Their concerns are the very result of racism, not the result of ignorance or apathy towards themselves or their children. If anything, it's the exact opposite. It's not apathy, it's urgency to receive care for themselves and their children in a way that is affirming. I want to make sure we hold on to that.
Thank you, Bree. So as we take about two to 5 minutes to really talk a little bit about the recent paper, I do want to really center the voices of the women in the learning session. And one of the things that came up was that research and researchers are not there for the women. They're not easily accessible. It's hard to find things. And so we really, at their urging, really want to acknowledge the research and really acknowledge the requests and the asks from the community to make not only the work, but the researchers available to them. So Deb, welcome. Thank you so much for participating. I know we're just going to absolutely scratch the surface, and I do encourage anybody who wants to hear more to join us next Wednesday. But I wondered if for the group you could talk just real briefly about what the paper was, who was included, and what you looked at, and what were some of the big findings from that.
Sure, absolutely. Thank you so much, Laura and Bree, for hosting this collaboratory. It's such an important conversation. And I really want to thank Yvette for that grounding as well. And I think that it's important to note that this paper really came out of a large effort from the Preterm Birth Initiative. And at the time that we embarked on the study, which was published at the beginning of August, there had been smaller studies and also case reports that were coming out about the experience of COVID infection in pregnancy and how it was related to birth outcomes. But we really wanted to extend this examination to the population level in California. So in California, the state started collecting information on the birth certificate, actually, about if people had a COVID diagnosis in pregnancy. And that allowed us to examine both the prevalence of COVID over time, which means what percentage of the pregnant women had COVID infection reported, and also the relationship of COVID infection with preterm birth. And given that we know that the burden of COVID infection and also that preterm birth is so much higher in Black and Brown communities as a result of systemic racism, as we were just discussing, we also wanted to examine if these relationships were different based on race and ethnicity or insurance, whether a pregnant mother had Medi-Cal. So the study included all 240,000 births in the state of California between July of 2020 and January of 2021. So importantly, this was before the sort of Delta wave of the COVID infections, and also was prior to the vaccine rollout. So what we found was that pregnant people and women who had a reported COVID infection during pregnancy had a 40% increased risk, or they were 40% more likely to deliver a baby preterm, which is before 37 weeks of pregnancy. And then we also found that they had a 60% increased risk of delivering very preterm, which is even earlier births before 32 weeks in pregnancy. We also looked at pregnant people who had a comorbidity, maybe they had high blood pressure or obesity or diabetes, and we found that that further increased the risk of preterm birth with COVID infection. So I'll stop there, Laura. If there are other questions, happy to answer.
Yeah, I mean, I think if you could, and I know we don't have a lot of time, and really, we highly encourage folks to use the Q&A function in the Zoom so that we're capturing your questions. We'll get to some at the end of this, but we're also going to really try and answer every single question and put it up on the website within the next few weeks. But Deb, I wondered if you could speak specifically to what was seen in terms of COVID-19 infections in individuals of color, and how that might or was not related to preterm birth.
Yeah, absolutely. So we saw pretty dramatic inequities in COVID infection in pregnancy among pregnant people of color, and in particular among people who identified as Latinx on the birth certificate. So births to Latinx pregnant people are about 40% of the births in California, but they actually represented 70% of the COVID infections. So you see this pretty dramatic difference. This is similar to what we've seen with COVID infection across the board, not just in pregnant people. We also saw higher rates of COVID infection among Native American, Indigenous, and Hawaiian Pacific Islander folks as well. Our study did not find evidence that the relationship between COVID infection and preterm birth was necessarily different among Black and Brown people, but we see that this burden of COVID infection is so much stronger, especially in the Latinx communities, that really it highlights a need to, target interventions, preventative mechanisms, and policy to the communities that are most at risk of COVID infection.
Great, thank you so much. I said Deb, but I do that, Dr. Karasek. Thank you so much. Bree?
Thank you. So as we move into our listening session now, we are going to view some videos and have some of our panelists respond. For attendees who have follow-up or clarifying questions, as Laura mentioned, we encourage you to type those into the Q&A box, and we'll be able to type an answer or answer some of your questions at the end. We are committed to answering all questions that come up today and that are raised by those in the listening session. As such, as Laura mentioned earlier, by mid-October, we'll have those answers posted on our PTBI website, and we will send a link to that with more detailed Q&A to all collaboratory participants. We'll also be posting a much longer video clip from the community listening session at the same location. So now, as we were thinking about this collaboratory, it was really important to us and to me, especially, that we center community voices to guide the discussion. We had a listening session that included 5 amazing women, 2 that were currently pregnant, 2 that had babies during the pandemic, and 1 who had both a baby during the pandemic and was also and is also currently pregnant. There were so many wonderful and insightful things that came up during the session for for today. We chose to focus on 3 topics: lived experience during the pandemic, information seeking, and bullying, shaming, and racism. We will spend 10 minutes or so on the first 2 blocks and 25 or so minutes on the last block. With that said, we'd like to begin with a very important question raised by one of the participants that really we need to start us off with.
All right, so my question is, after everything we've talked about tonight, is our voices really going to be heard? You know, every voice, you know, we all spoke about a lot of things, so are we really impacting this study, or is just, you know, it's for sure? You know?
Great, thank you so much. And I will say, just to share with the whole group, when Avina said that, every single person in the room, on the focus group or not, or the listening group, everybody was like, yes, that's it, that's the question. And so framing that and really putting into the room a place to really listen to the women on the session, in the session. So the first block is around lived experiences during the pandemic. And these in general were comments that participants made around sort of what was it like at the beginning of the pandemic? How did you stay safe? The stress in that space, but also challenges around, you know, going from one house to the other, or having children also in the house, and how do you keep everybody safe if they split their time? So we want to start with 2 clips from Kiki and Avina.
And then, you know, the main obstacle, again, is a mental thing for me. It was really, the media really portrayed in the beginning as if it was almost like a movie, like if I walk out the door, I'm going to drop dead. We didn't know at that point, is it in the air? We didn't know. They were telling us so much stuff that it made you wonder, like, okay, if I do this correctly this way, but then I don't do this, is that going to cause my family to be sick and, you know, I possibly die? It just had you so confused about which way to go, and nobody had any knowledge for you to really know what was right or wrong. Yeah. So it made it really hard for me to protect my family, because I felt like we weren't one of the ones who were wiping things down every time we went to the grocery store. DoorDash came and delivered something, like, you know, the man had to handle it and bring it to us. I wasn't doing that much because I still didn't know how effective that even was, you know? So I just feel like I went through a whole obstacle of trying to remember that our bodies are so good at fighting off illness. And I got to a point, I said, you know, you've overcome severe flus, you've had fevers, you know, you had chicken pox when you were little. So I realized, you know, I came through all these different illnesses, and I stopped one day and I said, you know what? It doesn't make sense for me to overdo all this, because if I end up sick, what am I going to do? Like, ultimately, you're going to fight. That's how I felt. Your body's going to fight, and you're going to make sure you do the best you can for your children who are incapable of helping themselves. So that helped me be able to be better in dealing with it as it, you know, came along my screens. They didn't talk about the 90% who were fine, who were doing well. They were talking about, they were talking about the 10% of people who were hospitalized and had autoimmune issues and all these different things. So once I started putting myself in the category of being somebody who could be healed, I was better.
When the COVID started, I remember I just came back from Ghana. So I was like, oh my God, did I bring something back or what? So I was very kind of scared, and I found out I was pregnant in Ghana. So when I came back, I was like, okay, I'm not even gonna call and make no appointment. because I don't want to be, at the doctor's office and, because they are very close to you when you go for checkups and stuff like that. So it took me a while to, make my appointment. And then finally I went there. And, even though they are taking all the precautions they can, people still get it from the healthcare, even though they are putting on all the whatever they need. Mm-hmm. So I was really scared, about that. But after I went like 2 times, 3 times, and I didn't catch no COVID, I said, oh, okay, I guess they are doing something, good or something like that. So I said, okay, it's good to put on your mask and, stay away from a lot of people and, just do the best you can, do all the precautions.
Thank you so much, Kiki and Avina. Dr. Tesfalo and Dr. Scott, just wanted to start with you. And again, thank you so much for your participation in this panel. Given that you were both caring for pregnant people at the start of the pandemic, wondered if you could each share a bit about what it was like to care for patients at the beginning of the pandemic. And then if either one of you or both of you have thoughts about how caring for pregnant women then is different than now in terms of providers. And Dr. Tesfalo, why don't we start with you?
Sure. And I just want to say thank you again to the organizers of this event, and importantly, the community members who participated in the listening sessions and who are listening to the collaboratory now for your questions. I think it's really important that we create spaces for us to be transparent about where we've been in this whole pandemic, and try to make sure that we're sharing as much honest information that we have as healthcare providers. I agree with, I don't know the name of the person who said it, but that at the beginning of the pandemic, it really did feel like a movie. I remember, talking, I don't have any children myself, but talking to my colleagues, people who were physicians who were living in a tent in their backyard when they were on rotations taking care of COVID patients to keep their children from being exposed. And I very vividly remember as a provider having to let patients know that that they couldn't have loved ones participate in their birthing process. I think early on we were so unsure about how things were spreading that we did harm by preventing people from having someone there to support them during their birthing process during this really scary time for them. And I think that, personally, I went a year without seeing my mother. I didn't, I was very nervous about traveling before vaccines were available, and I knew that she would be protected. So it was very surreal to feel like a pathogen, essentially, to feel like you might be somebody who could infect other people, and at the same time still wanting to show up in that space and to care for patients. I not only was on labor and delivery, but was in the ICU at various points during the past year, and it was heartbreaking to see patients who had no risk factors, who were young and healthy men and women and other persons, on a ventilator, and their families having to make really challenging decisions for them at a distance. So I think I just want to say I completely resonate with a lot of the concern, and also recognize that we also still have to live our lives, and that we need to think about how we can do things that help us get back to some semblance of normalcy.
Great, thank you so much. Dr. Scott, I know that you especially have deep experience in working both at community hospitals and at academic institutions. So I wondered if you could share like some of those comparisons, but also I know that you have some thoughts around sort of how things are different now compared to before in terms of caring for pregnant people.
Thank you, you all. Thank you to the community and the organizers and the panelists. My experiences in 2020 as a Black woman COVID long hauler at one of the largest managed care organizations in the US, as a Black woman physician scientist at a major academic center, and then also a Black woman dissident and disruptive OBGYN working at a safety net hospital. And my observations and my experiences of many types of harms, and I realized that we lacked the courage and the cultural humility to acknowledge that going into this pandemic, systems and structures in public health and healthcare, had already created hierarchies of human value that predetermined who gets to actualize and defend their right to life, liberty, and the pursuit of happiness, health, and wellness. And going through all of that was just really trying, because it was like watching, many of the movies I'm not going to name, but like it was watching in real time, literally the world falling apart, and especially within health systems and public health systems, because we just didn't know. But we did enter into the pandemic with a level of curiosity and courage and humility, but also with cultural rigor to truly listen and better understand that we all had differential risk and facilitators and barriers and burdens and benefits, both as a population seeking and utilizing care, but also as the institutions providing care. And in listening with the intent to create institutional alignment with and accountability to community and population needs and priorities, we failed. And being a physician and watching nurses and clerks and people scramble to try to figure out what to do, it was like I was watching two different movies, right? The haves and the have-nots. And I watched an institution that has be able to spit out protocols very quickly to their staff. And I saw another institution that didn't have as much. So the have-not institution caring for the have-not population, it was a tale of two different cities, a tale of two different health systems. But at the same time of surviving COVID, working during COVID as OBGYN, and then examining patient experiences, I was able to validate this tool. And the tool was patient experiences of obstetric racism. And people were like, are you sure this is the right time to do that? And I'm like, yes, this is an amazing, extraordinary time to illuminate what we've always known, that our system is riddled with racism and other types of oppressions that structure who gets to live, or who gets to live well, or who gets to die with grace, who gets to survive complications with humility. And what we learned, it was, the three core domains of our measure that's grounded in community words and feelings experiences were racism, disrupted kinship, and dehumanization. I'm not caring for patients right now. I'm only watching as physicians and nurses, as well as the population seeking help. The grief is extraordinary, and we haven't yet recognized how to humanize the care that we provide, but also humanize the caretaker. And so I feel like times the system put us as odd as patient population and as provider, and it didn't have to be that way.
Thank you, Dr. Scott. So moving on to our second block, which we call information seeking. And just to share with everybody, this was something that came up over and over in the listening session, and it took many forms. It was from, how do I find research related to pregnancy and COVID-19? How do I find research and information related to vaccines and pregnancies that hasn't been filtered through Google or celebrities? Really is seeking for stronger data. Where can I find information? But in really the other part of this, which starts to feed into our discussion around bullying and racism, was really feeling disrespected and dismissed when they had questions. So here are some clips from Bobby and our second Vanessa.
I feel like we need to be more aware of the history. How long were the trials that they did, and what, in contrast to other vaccinations. If we've just recently had this development of this vaccine, how can the public feel safe with receiving this vaccine if we don't know the history of the trials? For the, like I said earlier, the chickenpox vaccine was studied for like 10 years at least before they gave it to any human. So how can they, what can they say to us as a public to make us feel more comfortable with getting something that we know for sure hasn't been tested for 10 years with our bodies and now our unborn baby bodies? Also, why isn't there a balance in the information that we're given? Why don't we know about so many recoveries? How come we don't have a clear number of the people who have been living and haven't contracted COVID-19? And, you know, what does that say about natural immunity? You know, why is it that when it comes to the vaccination, natural immunity is like non-existent? You know, and why is it seen as such a derogatory thing for us to bring up our natural immune systems and our, you know, anything that is, why is anything that is against quote unquote science, isn't that science itself? Like why would we, you know, why can't we bring that up in a conversation without being demonized?
And I wish I had more information on like all these studies regarding like vitamin D and how that affects people, and how it's like a strong, not so much like homeopathic, but like a strong natural resource to fight off just viruses in general. So that's information that I wish I had before, instead of like all these theories about maybe it developed through this animal and that animal. Maybe like I don't care about how it developed. I have a lot, like one of my best friends is from northern China, and like I just do not give a shit. Like a virus could develop here, there, whatever. I really want more information on yeah, like what can I do to prevent besides just like the vaccine, even though I'm all for the vaccine, but I wanted like a strong, like more remedies. I guess I wanted information on that.
Great. Thank you so much, Bobby and Vanessa. So I wanted to start out with you, Dr. John. You have so much experience as an infectious disease doc and working with communities that have questions about medications, vaccines, treatments, and most recently, of course, working with communities around COVID-19. Do you have any thoughts that you'd like to share about the safety of the vaccine and how clinicians can do a better job of not only recommending that people that get vaccinated, but also answering questions they have and approach patient decision-making with sort of a grace that allows people to leave and come back and continue that conversation?
I like that word, grace. First of all, thank you all for the invitation and to be included in this amazing panel of people who are speaking truth, and to the attendees, and of course to the people who participated in the patients or women who participated in sharing their experience. You know, I think it's really important. I heard the word humility, and I think that that's a key part of this pandemic that has not been embraced by enough people. Both on the scientific side, you know, or I think one of the women spoke about getting mixed messages, the humility to know what we know and what we don't know, and that is an evolving position. And on the side to also have the humility to understand that that leads to a lot of mixed messages, confusion, fear, and concern, and really important to listen to people, to our community, to really be part of a shared decision-making process. And I'll share a story of a woman who ended up getting a vaccine at one of our events, the Black Health Initiative. I think Brittany Doyle is here. She's part of that with Wise Health that works with us. And we were partnering with Jonathan Butler in the San Francisco African American Faith-Based Coalition at a church site. And she had multiple children, and one of whom had immunocompromised state. And the pediatrician was like, she was like, well, what should I do? What should I do? And he looked, you should get vaccine, you should get vaccine, you should get vaccine, you should get vaccine, you should get vaccine. And that was completely unacceptable to her. And it turned her off of the vaccine, it turned her off in terms of getting her kids vaccinated who are above 12. And she had legitimate question about the child that she had who was immunocompromised, and even called the CDC, and they couldn't give her an answer. And when she asked me, I was like, at that time, I couldn't give her an answer. And they just didn't take a pause to ask the question, what is your major concern? And I think for me, when I give these talks, and I'll talk about the safety in a minute, and I'll be brief now, is that, I don't really aim to convince people to get the vaccine, but rather to provide information, to help people move, to make a decision, not out of fear or anger, because that's when we make bad decisions in general, but from a position of power and strength. And this is something that we in the Black community and our fellow BIPOC communities have had to do throughout our history, which is to deal with the structural racism that has been discussed or hinted at, really, we can go on in medicine, that has caused a lot of mistrust, but also the need to protect ourselves and our community. And I will say in the 1918 pandemic, the Black nurses and NAACP stepped up to do a lot for our community with regards to influenza when we couldn't get access to the white hospitals and the best technologies, as Dr. Scott's so well pointed out, exist today with COVID. And, at the same time, when you look at the polio vaccine, when the Salk vaccine came out, and contrary to a lot of belief, that vaccine actually was developed and Salk tested on his family and a few thousand people. And the March of Dimes basically immediately went into a large study of 1.8 million children, 600,000 got the vaccine. And Black doctors at Tuskegee, ironically, were the ones who helped develop the HeLa cells to test that vaccine, and actually fought, Black activists, Black doctors, Black scientists fought to have Black children included in that study, even though it was like less than a year of testing beforehand. And I remember a quote, and PBS just did a special, but I remember this quote of people really feeling special that Black doctors were being assisted by white nurses to take care of Black children and give them the vaccine. So I just want to, when we have these discussions, to remind ourselves that we truly do stand on the shoulders of our ancestors who have fought for us to be at the table. Now, we don't have to eat the meal. If you ain't hungry, don't eat, but we need to be at the table. And whether or not you choose to get vaccinated or not, that needs to be a discussion. And I just want to acknowledge that piece, because I also think we have a history of taking care of ourselves. Our community, our loved ones, we know, and it's not fair that we have this tension, that we always have this question, because we should. We have good reason to, but we know how to do it. When we're given the right information, we make the decisions that are right for each of us. And in terms of the vaccine safety, I mean, my medical opinion is everyone should get vaccinated. That's a medical opinion, but health decisions aren't made just on medical opinions, right? And I can give you a long list of reasons why I believe that. I will say that these vaccines actually are really safe vaccines. When vaccines come out, most side effects come out in the first year or so, really earlier in the first 2 to 6 months. I don't know of any vaccine that has long-term new consequences, something you didn't experience early on. Things like measles and meningoencephalitis, meaning inflammation, chronic inflammation of the brain, has been debunked. Autism and the connection with vaccines have been debunked. I'm not going to revisit those arguments here. We're talking about things like myocarditis, inflammation of the heart, that may be like up to 11 per 100,000. Things like the clot in the highest risk women group, about 12 per million, to give some context around these numbers. a woman on oral contraceptives. I think most of you know the clot rate's about 1 per 3,000. And if you get COVID, your risk of dying is about 1 in 1,800. So these are numbers. I'm not here to tell you if that number is acceptable or not, but it is important for us to contextualize the reality about how vaccines develop. And I just wanted to end on that last piece, because there was a great question about the length of time. To be clear, it doesn't take 10 years for vaccines to necessarily come to market. It really depends on the vaccine. When they developed the Ebola vaccine, that was very quickly done by J&J to respond to new pandemics. And at that time, people knew pandemics were going to continue to happen more frequently, and we needed to be better at developing vaccines and faster. These mRNA technologies have been around since the 1990s. They've been piloted in cancer research before infectious diseases like melanoma or skin cancer, published in the Lancet, one of our best scientific journals. They were dealing with tens of people as opposed to thousands and now hundreds of millions of people as we do with the mRNA. But remember, two things limit vaccine development: money and people at risk, both of which were addressed in this pandemic. It's too bad they called it whatever they called it. What did Trump call it? I don't know. Project Zoom. I forgot what it is now.
I think Operation Warp Speed.
Thank you so much. We're going to move to the next one, but thank you so much, Dr. John. Just so grateful for your expertise in this space. So Dr. Rogers, I know that you counsel a lot of new parents around the vaccine question as well. And I know that there's a number of parents on here. We are at 161 or so, but I wondered if you could talk specifically around how you counsel parents who are both wondering if they should get vaccinated and also starting to think about whether their 5 to 12-year-olds should get vaccinated. Do you have any thoughts on the efficacy, but also how to talk about this in a respectful way that really meets people where they're at?
Well, yes. First of all, I appreciate so much being included, and I am thrilled that around the format of this collaboratory really being based in community voices and community concerns. So I'm just really grateful to be participating with this amazing group of panelists and particularly all of you listening. I would say Dr. John should consult everybody, because I was already thinking, really struck by his words about using power and strength and not fear. And I think that's hard to do. I think to speak to Dr. Scott, I think our healthcare system almost always responds to things based on fear, to be truthful. And that's particularly, which we're not talking about right now, but particularly impacted us in our visiting, families visiting. First of all, families are not visitors in a hospital. In particular, parents of newborns who are in a intensive care unit are integral team members and not visitors. So that was a huge, I think, mistake on the part of health systems who kept parents from the hospital when their babies were being cared for. It was a huge loss and mistake on the part of our system. And now, yet, we are also facing very similar healthcare decisions, because now visitors to hospital, whether part of the care team or not, are also being required to be vaccinated. So that speaks to your point, Laura, and your question around how do you talk to about vaccines to parents of critically ill infants, and then about their children. So I've elected to ask, do you have questions? I also see children and parents in our follow-up program. And so there I have an opportunity to spend time when their child is out of the hospital. And that's often where we can engage in more conversation. And typically what I'll say is, do you have any questions for me about the COVID vaccine? And truthfully, the vast majority of people say, no, I don't have questions. Either I already got it, or I've even had someone say, no, I'm an anti-vaxxer, using those words. And then I can say, well, I'm happy to engage in questions, anything you're worried about, anything you want to know more. And then I will have those few people say, this has been on my mind, and no one's asked, what they want to hear, or whether I have anything to say about it, or what my questions are. So we'll be able to engage in conversation by just allowing for it. I will say the decision to vaccinate children has also been very much debated, and obviously this is going to be at the forefront in the coming month or so as we anticipate an EUA for the Pfizer vaccine for our 5 to 11-year-olds. And again, this is now even more than the risk I'm taking for myself. It's the risk that I take and the responsibility for my child. I think it means even more so we need to embark upon true discussion, as Dr. John called for, because I think the data in terms of, protecting children from severe disease is one thing, and yet I hear from a lot of families, whether or not we're preventing severe disease, any disease for my child is unacceptable. And so, what are the real questions that people have, and what's holding them back? And I just agree with everyone that I think real, authentic engagement with their healthcare providers would go a long way to just, I think, increasing comfort to vaccine uptake. I don't know if that even answered all of your questions.
No,
Yeah.
thank you so much. And thank you, Dr. Rogers and Dr. John. Bree.
Thank you. So now we move into our third block. This third block is bullying, shaming, and racism. These topics were brought up throughout the entire conversation. It was a 2-hour-long conversation. And at every point, you could pick out a part where someone was being bullied, where someone was being shamed, and where a lot of it had to do with racism. We wanted to spend the most time talking about this topic because it is something that we all know, but rarely ever act on. We'll hear discussion or comments from Vanessa, Bobby, and Kiki. And Avina, sorry.
And during my first pregnancy, I didn't really get enough information from the doctor. But during this pregnancy, I went there. She actually sent me a text before I even went for my appointment. She's talking about, how to take the vaccine and it's helpful and, saying all the good stuff about the vaccine. So I went in for my appointment. And she still asks, it's like she's giving me pressure to take the vaccine, which I don't like it. Let me take it up on my own accord.
That is, I had a doctor, as a matter of fact, when I was going to call when I was very sick, and he said, well, are you vaccinated? And I said, no, I'm not. May I ask why? And I already knew that I was going to get into this whole tirade of questions, but I was ready because I'm used to it now. And I said, no, it's religious reasons. What religion? And so he just was bad, and I didn't even think of it as badgering because I'm such a open person, and I'm somebody who likes to conversate anyway. So I didn't even take it as him badgering me at the time until I started talking to other people. They're like, why would you let him ask you that? That's not his business. Da, 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 da. Yeah. So he was asking, well, what's your religion? And so I'm telling him, and then he goes, well, may I ask where science is in that or something, he said to me. And I'm like, what? And that's the part that had my antlers go off. I said, he doesn't want to know because he's interested in, my reasoning. It's because he wants to be able to have a rebuttal for whoever he talks to next that also has a religious, preference. I had an incident, and I think I told one of my friends this last night. I was at the grocery store. And a Caucasian woman walked up to me, an older woman. And again, I'm very social, so I speak to people. I'm not one of those kind of people who's like, who are you? Why are you talking to me? I always end up with a friend at the end of my shopping visits. But so I was going into the meat aisle, and I was running in. My twins were in the car with their aunt. And she walked up to me, and at first she was very casual. She was like, oh, are you expecting? And I remember I had a shirt on that was kind of bigger because it was one of my, my bigger sweatshirts. And I said, oh, no, it's just a little large in the front, but I did happen to have kids. She said, oh, okay, because you and your twins could get vaccinated. And I was like, it went so over my head that, again, some things, when I'm in it, I don't really see it. And then when I share it with somebody, they're like, what? That was racist. How could she assume that you're not vaccinated? And I didn't look at it like that. And then later on, I realized, I'm like, this is how people really view us. They really believe that we're walking around here intentionally trying to get our grandmother sick and our family members sick, and we're going to be in the opposition of everything that comes because we want to be in control. All these stereotypes and stigmas is how people really see Black people. Particularly me in the grocery store, you chose me out of everybody to walk up to and say, you know, you could get vaccinated. I couldn't even argue with her and say anything to her because my mind was so blown that she tried to come up to me and have a casual conversation like, you know, it was any other day. So I just looked at her and I said, this is really unfortunate that I looked at her and said, you know what, I sure could. And I kept it moving. And I know she felt so embarrassed because my reaction was not what she probably also stereotyped me. She probably thought I was going to, you know, tell her off. But I ended up walking away and I just thought about it. I'm like, wow, they really believe that we are the ones who are causing this spread.
Yeah. I've had that type of encounters. I'll talk to a fly. And and I've literally had European Americans tell me things that, you know, they're giving me information about, oh yeah, you live in Oakland, you live in West Oakland. They have a lot of vaccination stations. I'm like, I know, I see them. I do notice that the people who are asking are people who assume that you didn't do it. But like she said, it's like they assume that you're not going to get vaccinated. And I did engage one conversation, and I was like, well, yeah, I have most of my family is vaccinated. Really? She was like super shocked. She was like, wow, you know, what brought that on? Are you going to join them? And I was like, maybe possibly after the pregnancy. You know, I don't really engage, you know, like confrontation, but it's just like, you know, possibly after I have my baby, I will. Well, you can, and you can do it now. I was like, okay, ma'am, thank you.
You're a doctor.
Right.
You know. And that's what I think keeps us divided. You know, as much as we try to overcome racism and, you know, being a part of other cultures and accepting other cultures, things like this have caused a super divide.
If, depending on who you are, you have a super spreader party. And then depending on who you aren't, oh no, they're fine. I think everybody, and then they already assume everybody at Nancy's party was vaccinated. So, but then
so you're saying it's not just only racism, it could be classism as well.
For sure.
So if you're poor or lower income, they are giving you a stigma, and if you're rich or middle class or have money, it's something that's totally different.
I hear a lot of talk about African Americans and brown people being, you know, the highest rate of this or that, which is the case for some disease. I do know that that's true, but particularly for the vaccine, there's not a lot out. Why is the media not talking about the 10% of people who are way lesser than the 90% who are healing and coming over this vaccine? Why are we not pressing towards helping people build their immune systems and making sure that if anything were to mutate, which we see is happening with this Delta variant, what you can do to prevent the next mutation? Because you might have the vaccine for this part, but what's going to happen in round 3? So I just want to know why they're not giving more education about how to naturally protect yourself and your families.
Thank you, Avina, Bobby, Kiki, and Vanessa, for those great words. So I'd love to hear from our clinician researchers of color, in particular about the issues raised by these community voices. What are your responses to what you've heard, and how do you think the healthcare system can do a better job at addressing these concerns? So Dr. Tesfala, Dr. John, Dr. Scott, whoever would like to start.
I'll go. Thank you again for this experience. So yes, okay, these are my thoughts. So listening to community experts now share their stories of bullying, shame, or structural racism, it resonates a lot with me and reminds me of the experiences of Black mothers and birthing people who participated in our Sacred Birth study in 2019, 1 year before the pandemic. And I just want to briefly share this because it perfectly aligns and it shows again We're only experiencing what we've always experienced, and the pandemic is just illuminating it. And we need to do better, do and be better. So the areas we focused on that I'll share are about autonomy and dignity and Blackness, particularly around truth-telling and transparency around the data. And on the question assessing autonomy, the question was the hospital almost never or rarely made sure Black mothers understood the information shared with them by asking them to repeat back or write down what they heard, despite the fact the majority of people in our study reported that they understood, but no one assessed their comprehension. So per the 1974 Belmont report, informed consent for research consists of information, comprehension, and voluntariness. We lack accountability for ensuring informed consent and refusal in the healthcare system with dignity, right, and with grace. And all three must be adequately satisfied if we're going to obtain informed consent or informed refusal. So we also found in our study that based on our data, hospital clinicians and staff violated informed consent, specifically comprehension, among 60% of Black mothers and birthing people, which represents 348 hospitals from 34 states in DC. And the area about dignity, the hospital almost or never rarely shared their data on birth outcomes and reassured Black mothers and birthing people about hospital-wide efforts to address racism in obstetric care. And our data showed that hospital clinicians or staff failed to provide dignified care by acknowledging how hospitals undermine the dignity of Black mothers and birthing people by denying the truth about the epidemic of death and almost dying to 81% of Black mothers and birthing people. That was just about death and dying while giving birth in the hospital in 2019. So again, we're in the pandemic, and very similarly, we are not embedding humility and cultural rigor and dignity and grace in the way that we communicate our interactions, our communication, our counseling, our shared decision-making, and we are actually perpetuating harm in the dissemination and documentation of patients' behaviors and decisions in our patient handoff and electronic health record. So we can and must do better. The community keeps telling us that we are not coming to them with curiosity, with humility, with grace to just better understand the context of how they're living and how they're making decisions and how we can just better support. I even tell patients, I may not agree with your decision, but I will respect your autonomy. And let it go and be like, I'm here to facilitate. I am not here to control, to censor, constrain. I am a facilitator and helping you get what you need. And if what you choose right now and what you need does not align with my profession or my standard of care, that is not a place for me to evoke violence upon a patient. It's just to continue to be curious and gracious and seek permission. When you're ready to speak again about it, I'm here, let me know. But we weren't taught to do that, as evidenced by the bravery and of our community experts who are telling us what they continue to experience.
Thank you, Dr. Scott. And I'm gonna piggyback on that. I'm an HIV doc during the daytime or historically. And so I definitely have had experience with folks who have chosen alternative options for their care, both in terms of when to start medications, and have made some choices, not only around HIV, but others that I wouldn't make for myself or my family members, but I'm there to support them. As long as it's not unethical, right? Most of these decisions are not. I want to bring up 4 points. One, to address this issue, it's all about trusted messengers. And I think the Black Health Initiative, working with Brittany Doyle and Wise Health, we really focus on bringing back Black UCSF to the community, really to connect people who have a shared lived experience. We focus on centering those who are already doing the work and those from the community in our partnerships, whether with the Black churches or now with Booker T in the Western edition. As trust, we should be present as healthcare experts, but we don't have to be the loudest voice or the first to speak. It's about listening. I also think it's important to center those who have experienced COVID, either taken the vaccine or had the disease and healed. That's really important. I think we also need to confront and address the deep historical traumas that have been discussed, and I won't revisit that, but I think that's an essential part of any conversation around health in our communities. Third, I think it's important to be transparent on what we know, what we don't know, where things are headed. And I think humility is a piece, and curiosity is a piece of that, both in terms, I think, of everybody, both from the health system, but also from those in the community. We should be at the table to just do right by ourselves and our community. And that brings me to the last point, which is connecting to the core values within our community, which is that we really want to save Black lives, Latinx lives, other BIPOC lives, and lives in general. Vaccination is a part of that. And I think that's a fair and transparent conversation, but it's not the only part of that. It's an and, or it may be an or for some people, but it's, what is not prioritized when we talk about vaccination is all the other health needs and disparities that existed beforehand. We don't talk about, my family's from the West Indies. My grandma boiled bush water for me to drink and gave me molasses. And when I don't know what she was doing, but it worked. I'm here today. And so, centering some of those alternative and understanding if someone wants to do that, that's part of care. So, one of the things BHI is doing is our Healthy Streets initiative, developed by concept by Brittany Doyle, where we really focus on the more holistic issues. We focus on spirituality and behavioral health, because mental health is a big issue in our community. So we have a spiritual table, we have Black behavioralists, we focus on diabetes, nutrition, hypertension screening with the Black Nurse Association, driving that, food insecurity and recipes of traditional recipes with healthy substitutions. We focus on lifestyle, sexual health, exercise, workforce development, and of course, COVID testing and vaccine is included in that as well. And I think that the point is that health disparities existed before COVID. They've been magnified with COVID. People have real needs, food, money, jobs that really are much more fundamental and broad, affecting in general health. And that needs to be part of our discussion when we talk about COVID. And I think people are put off when you just like, what, are you just trying to shove a needle in my arm? I mean, that's not and should not be the message. It's about your whole health and wellness. And yes, dealing with COVID is part of that, because that's the pandemic. And I want to end with, this is not it's such a very hard time, because I always say, is it unreasonable for people to say, I want to wait a year or so? No, of course not. But the pandemic is moving very quickly. And we live in a time where everybody's rushing data out, both from the mainstream media, but also social media. And it's very anxiety provoking. And I just want to emphasize this, this is not a footnote in history. This is a chapter in history. They will forever be talking about this. And if you're not having angst or anxiety, then you are one cool cucumber. It is a challenging time. And if you're someone, I've spoken to some folks, like, they don't believe in Western medicine, but sometimes they have gone to a doctor or gone to an ER. Well, this might be one of those circumstances to think about Western medicine, because it is literally a chapter in history. But again, it's a conversation in time, over time, as Dr. Scott said, and people may not make the choices that you may make, and that's okay.
Yeah, thank you. Thank you. Dr. Tesfala?
Yeah, this is so great. I'm just appreciating hearing from everyone about all these topics. I think one thing that really, was so hard to hear was the experience of the community experts around just feeling judged, and people's perceptions around them making choices kind of haphazardly or without caring or compassion. And I think that that has been the opposite of what I have found in conversations with patients who have, who have expressed uncertainty about whether they want to get the vaccine. And obviously, from what we are hearing today, people want to protect themselves. There was a recent study I saw of parents who were, expressing their support of mask mandates, and Black parents were more likely to support that than white parents. So I think that sometimes, just the way we sort of frame these issues can make it's just hard to hear that people feel like they're being judged for being bad parents, when really they're just seeking out information. And along those lines, I think there's a lot of rhetoric around mistrust or patients don't trust us, but we have to do the work to build that trust. And hopefully conversations like this one and work that Dr. Scott and others and PTBI and others are doing will help get us closer to rebuilding that trust. One of the questions that, well, two things. The other one thing that one of the community experts had asked was, what can we do to decrease or protect ourselves from these variants to decrease the chances of getting them? And that's where vaccinations are, I think, really important. The less that this virus spreads, the less likely it is to mutate. We know the more it spreads, the more people who have it, the more likely we are to see new variants. And we've been fortunate so far that the variants still seem to be that you're still protected against them with the current vaccines, but that may not be the case. And so the more that we can get people vaccinated, that's the best thing that we can do. The question that came through the chat around data in pregnancy and breastfeeding people was a really good one. And I think in the beginning, when the vaccines were coming out, that was the biggest challenge that I had as a pregnant, high-risk pregnancy doctor, was that the pregnant women and women that were trying to get pregnant or breastfeeding were deliberately excluded from the trials. And while some people did get pregnant kind of during the course of their vaccination series, there was not really a lot of data. And so early on, we were deliberate about making sure patients were offered the vaccine if they were pregnant or breastfeeding, but had to be very honest about the fact that we didn't have enough data at that point to say that they would gain as much immunity as other non-pregnant individuals had in those studies. We didn't know if the antibodies would if the response would be as robust, if there would be any higher rates of side effects, all these kinds of questions that we weren't really sure about. And I'm really glad to say that at this point, we have so much data. It's observational. So as scientists and researchers, I think when you're looking at vaccine studies, we like to do a randomized control trial where we give some, pregnant or breastfeeding patients the vaccine and some of them not, and see what happens. And those studies are happening, just that data is going to take longer to come out. It might hopefully be here in the winter, but we have data, observational data captured by the CDC through the vSafe program. So anyone who has received the vaccine is eligible and encouraged, I would say very much encouraged, to sign up for the vSafe registry. And they are following patients who either indicate that they're pregnant at the time of receiving the vaccine or during follow-up. And I think there's something, the most recent numbers I saw were about 140,000 individuals who met that criteria who had been vaccinated. And then they have a smaller cohort of those in a vSafe pregnancy registry, where not only do they fill out the information online that everyone non-pregnant also fills out, but they also get phone calls and more detailed follow-up to find out their outcomes. And there have also been many studies, some of which conducted at UCSF, that have shown that the vaccines are effective in pregnancy, that the responses are as robust as they are for non-pregnant individuals, that the side effects do not appear to be more severe, that you do see you do see the antibodies that cross the placenta and then also are in the breast milk to help provide protection for neonates. And I think that one of the things that came up was this question about when to get the vaccine. And I would say as soon as you feel like you have enough information to do it. We're encouraging it for people who are even considering getting pregnant during the course of their pregnancy. Some patients may consider waiting until the second trimester to receive it, because there is an underlying risk of miscarriage in the first trimester that's much higher than people normally recognize, anywhere from like 1 in 7, some studies even 1 in 5 pregnancies end in loss. And I think it's very challenging to not blame anything that you did, let alone receiving a vaccine, going on a trip, feeling stressed about something. That window can be really challenging. And I think sometimes for patients, it's easier to wait till the second trimester, but medically, there doesn't seem to be any reason to do so. You can also wait till you're breastfeeding, but I think one of the things that we do know is that there are different types of antibodies that you pass when the baby's inside the womb versus when the baby's outside. So may not be that interesting from a lot of people, but for those who are interested, there's kind of IgG antibodies that get transmitted in the bloodstream through the placenta if you get the vaccine when the baby's in utero, and then when the baby's born in the breast milk, you really only get IgA given to the baby, and that helps provide mucosal protection, so it kind of gets in the gut. And that's great because we know that the COVID virus tends to enter through, mucous membranes and things like that. But if you want sort of more robust protection for your kiddo, then getting it before pregnancy is a very, very reasonable and appropriate. And I think the other thing I'll just acknowledge is that things are changing, and so I think that's why it's very reasonable to have questions. And just this week, the CDC released guidance about boosters, and offering those to patients in pregnancy is included on that list. So for those who've already been vaccinated, who want to do something to provide even more protection, it's important to know that you can talk to your provider about having access to a booster. But I don't know. There was a lot of things that were running through my mind. But
No, that was
great.
That was amazing, and that really helps us move sort of this. I don't know how everybody feels, like this was a really fast hour and a half, enormously fast. So thank you so much, everyone. Believe it or not, we need to move to the closing just to honor everybody's time. But again, I want to reiterate: if you have questions, we'll be collating all the questions that came up during the listening session, during this, sending out information to gather questions, and then we're going to really work with the panelists and others to get all the questions answered in the next 2 weeks. We're also going to put more information up about natural immunity and how do you get to information about vaccine trials. So everybody should be on the lookout for that, that email. But thank you, so grateful. Bree, sending it to you to close us out.
Yes, thank you so much, everyone. Again, our panelists, our participants. This has been great. I do want to go back to our original video of Avina asking if their voices will be heard, if their questions will be answered. And so one of the ways that we thought to address that right now was to create an accountability Jamboard. So we have an accountability activity where all of the panelists will receive the Jamboard link, and you can go in there and put some of your thoughts around what providers can do in the immediate to be accountable to the voices and to the issues and concerns that were brought up today. We know oftentimes things take time to implement, but there are some things that we can do right now. So what are those things? And with that, once we have answers on there, some responses and things, this Jamboard will also be posted on our website, on PTPI's website. So providers can view this, patients can view this and tell your provider, this is what I want you to do for me. So we hope this can be useful for everyone. I want to thank everyone for joining. Thank you again for your attention, for your thoughts, for being open to hearing what everyone has to say. We really appreciate it.
Thank you.
Thank you, everyone.
Are you looking for what we should do as individuals or as a community?
Yes,
or
all of it?
Oh, okay.
Anything.
All
like
of it.
How to hold yourself, and we all have this, providers or not. How do we show up for the people in our communities and support those doing important work?
Yes. Oh, and again, we hope you'll join us next month for our October Collaboratory entitled Centering Black, Queer, and Trans Birth. The RSVP is in the chat.
Thanks, everybody.
Gracias.
Bye. Thank you.